Hi, my name is Dr. Kevin Mueller. I'm the current chairperson for the AACP meeting up in Spokane, Washington this summer in August. I want to introduce a good friend of mine and a mentor for many years, Dr. Glassman, and I think it's important that you get his take on why this meeting is so important for general dentistry and anybody that's going to be treating craniofacial pain in their dental practice. Thank you.
Several months ago, your esteemed program director and I spoke about the possibility of bringing a practical and evidence-based message and model option to the AACP's annual conference in Spokane in August. You know, evidence-based has been given a very bad name. Evidence-based has been used by some insurance companies to deny perfectly good treatment. Evidence-based is used by some practitioners to disagree with and argue over concepts proposed by other practitioners or speakers, etc. Sackett did not suggest that evidence-based should handcuff the practitioner and keep him from using his own clinical experience in his decision-making. In fact, that's part of evidence-based concepts, that one should use that evidence, the preponderance of that evidence, added to your clinical experience to make good decisions. We're excited about the possibility of bringing such a concept to the conference, and I agreed to participate, and we began putting together what I think is a kind of a dream team whose goal was to put science in front of politics and present a practical approach to common issues and disorders seen in a general dental office and even in an office who tends to see more orofacial pain, joint dysfunction, and sleep disorders than a general dental office. I can't tell you how excited I am about this group of excellent practitioners and leaders in their field who have already met on a regular basis. To be sure, our message is clear in a way that I've never seen it happen at a conference such as this. We have Bob Muir, the current president of the AAOP, who has limited his practice for years to orofacial pain and sleep disorders, and who is just an excellent presenter. In that same class is Steve Bender, an ex-president of the AAOP, and whose practice is based at Baylor University, where he also teaches both at the graduate and undergraduate level. We have Steve Scrivani, who is a long-term educator, editor of several books, written many papers, and is the past clinical director of the craniofacial pain program at Mass General Hospital, and for years taught at Tufts University's Craniofacial Pain Center. We have Wade Cooper, a neurologist whom I think many of you are very familiar with, from the University of Michigan. We're excited to have Wade on board. And Don Melizia, my colleague and probably the best read dentist in the world, and he's just brilliant and an excellent presenter, and you'll enjoy him for sure. And we're introducing Dr. Micah Sadiq. Dr. Sadiq is an absolute genius. He is a clinical psychologist. He is a full-time professor at a local university in the Lehigh Valley. He practiced with me in my office. He's written several books. He's an expert on autogenesis, and with an understanding of the critical role of psychology and emotion in pain management. His presentations will be just incredibly worthwhile. And I too will be speaking on the model change that's required and why so many people fail in craniofacial pain programs, and how we can make ourselves happier and more successful treating pain, joint dysfunction, and sleep disorders. There is a pre-course with the radiologist from Harvard, Dr. David Hatcher, on the day before the conference on Thursday, and Dr. Scrivani and I will be there attending the course, and will participate in and monitor a interactive discussion at the end of that course. We're really excited about this group, and I'm looking forward to returning to the AACP after many years, and looking forward to to meeting many of you and seeing some old friends. And I strongly encourage you to come and spend the weekend with us. You won't regret it. Thanks.